beneficiaries and providers are especially evident, those of us who represent districts that aren't completely urban. Our constituents are seeing firsthand the difficulties caused by overregulation and bureaucracy. And it's our rural neighbors who pay the prices when it comes to access. Take, for instance, the so-called 96-hour rule. Here, critical access hospitals are a critical piece of rural health infrastructure. Doctors at critical access hospitals have to certify that it's reasonable that an individual would be discharged or transferred to a hospital within 96 hours of being admitted to a critical access hospital. That arbitrary cutoff doesn't always match the medical reality for patients seeking treatments at facilities near their homes. I've personally heard from St. Joseph's, a critical access hospital in my district, on the problems with the 96-hour rule. Or consider the rules related to physician supervision. Physician shortages are a reality in many parts of our country. Rules that change the way routine therapeutic services are handled in rural areas, or rules that bar physician assistants providing services like hospice, disrupt access and the continuity of care for rural beneficiaries. We can do better. We must do better, and we will do better. We should provide relief for all of our hospitals and providers from overly burdensome regulations and bureaucracies. There's no better place to start that process than with our rural hospitals. There's much to be done, and today we're lucky to have here firsthand accounts from providers serving rural communities. First, we have Shannon Sorensen, a CEO of Brown County Hospital in Ainsworth, Nebraska, and a constituent of Mr. Smith's. Next, we have Tim Jocelyn, the CEO of Community Regional Medical Centers in Fresno, California, a constituent of Mr. Nunez's. Then we have Carrie Saya, CEO, there you are, CEO of Holton Community Hospital, a facility located in Congresswoman Jenkins' hometown in Kansas. Finally, we have Dr. Daniel Dirksen from the University of Arizona. We're very happy to have you here today. This is the latest in a series of hearings held by the Health Subcommittee in the wake of the passage of legislation to fix the way Medicare pays our nation's physicians. Now, I know we mentioned this at our MedPAC hearing last week, but it stands repeating. We're in the midst of a great opportunity to reform how Medicare reimburses hospitals and post-acute care providers, all critical to saving Medicare for the long term. I hope today we can make progress in understanding the concerns facing those in rural areas.